Hi, I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and welcome to our Wednesday afternoon show. Today is National Botox Day, thus the t-shirt, because yes, I love Botox. There is no doubt about it. It is one of my favorite things on earth. Now, if you're trying to buy the gift cards, there's such an overwhelming response that the whole system has crashed. I have been told that the gift cards are still available, but they're trying to fix the problem. So just keep trying. I apologize for the headache, because it has been for everybody involved. But the link is, I think it's BOTOXcosmeticday.com. So keep trying, and hopefully that will go through. And if the gift cards are already sold out, they're supposed to be doing another round that if you buy, I think a $100 gift card, you actually pay $75. So keep trying and we'll see. And then I have a feeling that they'll do something else to try to make this problem go away. But how exciting is it that there's been so much of a response for this? I mean, as I said, I love Botox, so that just shows that so many other people out there absolutely love it. So what we're going to do today is my whole team is due for Botox, so we're going to go ahead and show you some Botox injections, and then either Taylor or Jill will give my Botox at the end of the video. So let's talk about where you can have Botox, which is FDA approved. So my lovely model, Dr. Rob Wise, aka my hubby, we made him be the guinea pig first, and so I told him he can't cry, so no crying.
No crying in Botox.
No crying in Botox, that's right. Okay, so it has been just about exactly 3 months since our last treatment, and he really doesn't have a whole lot of movement. So the 3 areas that are approved for treatment with the FDA is our glabella region here. So go ahead and furrow for me like you're angry, not at me, but maybe at somebody else, the dogs maybe. And he really doesn't have a whole lot of movement. So we're actually going to back off his units a little bit. The FDA has approved 20 units in that area. My average person's about 24 units, but right now on him we're probably going to do 16 units. So that's area 1. What we're looking at when we're looking at the glabella region is it creates these lines going this way, and those are called our 11s, or we call them angry eyes. So it's relaxing this muscle, and this little muscle in here. So therefore giving this whole area a smoother appearance. Does it tickle? Sorry. Okay, so that's area 1. The second area that was approved is actually the forehead. So go ahead and lift your eyebrows up. And this, oh people, I cannot stand that movement. So that's why he's on the table first. So he has a large forehead, and normally it's true. There are little baby foreheads, and then there's a little bit bigger foreheads. So his is big, but really he doesn't have much movement up here. So we're not going to focus up here. Usually I do 20 units on his forehead, which is actually what is indicated, but he does not need 20 units. So we're going to bring the injections down just a little bit. I think we're doing 10 or 12 in there. So that's area 2, and then area 3 are our crow's feet. So go ahead and smile real big that you're so happy to be here on video. And his crow's feet really are not that bad either. Usually I do, I think 24 to 30 in there, and I think today we decided we're only going to do, I don't know, 16, so a small amount. So as you can see, Botox is not cut and dry for every single person. So we actually will evaluate and decide what you need that day. So just to review, the FDA has approved 20 units, 20 units, and 24 units around the crow's feet. But most of us do a little bit less because we've been doing Botox for so long that we don't need as much. So let's go ahead and get him treated. We do have him in here.
He's right here. I got him.
Oh, you have it. Okay, thank you. So normally with the glabella region, normally you have 5 little injection points, but as I said, he's not moving all that much, so we're only going to do 3 injection points with that. Okay, great, thank you. So, are you okay sitting up, or do you want to lean back some? Okay. Botox can take take up to 2 weeks to kick in. It's usually 3 to 5 days. So I always tell everybody, don't expect miracles today, but hopefully in, hopefully 3 days. That's the average. Okay. You ready? You want to lean back? You okay? Okay. So this is actually relaxing the muscle that's going here and helps with this line. So furrow for me. So you can see how that muscle is coming down and creating that little line going across. A little fuzzy there. Okay. And so that's what we're trying to do, is relax it so that he can't do that and therefore won't have the lines. Okay.
Just a poker face.
Just a poker face, that's right. No emotion. No, that's not what we want. That's the beauty of Botox, is that you really just look relaxed. You should not have a completely frozen face. We want to see some emotion. See this emotion? We have it. Okay. So emotional. So then I'm going to move to the forehead. So have you turn just a little towards me. And let me point out here, so these are normal little bumps because the Botox is mixed with some normal saline, and those will go away within about 5 minutes. They won't last very long. Okay, so go ahead and lift those eyebrows up and relax. And so we're just going to go straight across his forehead. And this will relax this lower part. I don't typically do 20 units on patients because 20 units relaxes this frontalis muscle. And the frontalis muscle, go ahead and raise your eyebrows, that's what raises the eyebrows. So if this is completely relaxed, you can't raise your eyebrows. It causes flat eyebrows and sometimes can even droop them down. So the little trick with this is do less, but then you do have to come in a little bit more. So instead of doing it every 3 months, you might do it every 6 to 8 weeks. And that's how I prefer to do it because I don't want drooping. So that's taken care of. And now we just have the crow's feet. And I'm gonna have you smile real big and relax. And typically in here, you do 3 injections, but because he does not have a lot going on, we're just doing 2 little injection points. Good. And I'll come to the other side. Smile really big and relax. There we go. And last one. And so part of the process in the beginning is, patients are really afraid that it's going to hurt. On a scale of 1 to 10, 10 being the worst, how did it feel? About a 1? Yeah. So the anxiety of having the injections the first time is what's a little bit scary, but everybody says after the fact, like, oh, that was it? I can't believe how easy that was. So that's the beauty of it. Okay, sir, you're all done.
Thank you.
You're welcome. Your Botox will kick in a few days. And
Right.
for new patients, I usually have you come back in 2 weeks just to make sure that we have, decreased the amount of movement. And I say decrease because we don't necessarily want to take it away. So, hi, I'm next. So, so while I get ready, talk.
And
Talk
go.
about Botox. Talk about how, talk about the Botox
Oh
Club.
yeah,
Talk about
yes.
the Botox
So
Club.
our Fountain Club offers you the ability to get all your Botox at a discounted price, and then we can do a monthly payment. So it gives you a chance to bank your Botox. So when you come in every 3 or 4 months, it's already prepaid. You come in, do your treatment. It's all discounted at a lower price per unit. And then you get all the rewards within the clinic of 10% off all the products and services, discount on the filler. I'm trying to think.
Pretty much
Am I missing?
everything.
Yeah,
Yeah,
everything.
everything
Yeah,
is
you get
here.
discounts on everything. Nice perks throughout the year and benefits as well. Am I missing anything?
I don't think so. I think
Okay.
it makes it so much easier.
I feel like I'm on
You're on camera?
Yeah.
Are you on the camera? Yes, you are. So Nicole is my personal assistant who helps with every single thing in this clinic. And so the majority of patients after our Botox or filler will go to Nicole. She'll help with brand distinctions and help with everything. So she is an absolute gem for this clinic, and I can't live without her. So there you go. That's
Nicole.
So today I'm going to explain my treatment. Today we're actually going to skip my crow's feet. I don't really feel like I need it right now. And so we're going to just do my glabella and forehead today because I cannot stand movement in my forehead. It drives me crazy, and I've got lines for days.
It's awful. It's awful.
Hold on.
Yeah, somehow you have a black ink mark on your forehead too. Do
Oh,
you want to lean back?
sure.
Okay. Okay. So we're doing 15, and you know, the reason why we can do less in all of our treatments is because we keep up on it, and we've been doing it for a very long time. So just because we have teeny amounts doesn't mean necessarily that you're going to have teeny amounts, but yes, over time you should be able to either decrease the amount or go a little bit longer. But the average person is 3 to 4 months that it lasts. And so I can't say that after 2 years, it's going to be that way. It might be 5 years before it lasts a little bit longer. And so we also, the lovely thing about working here is that we do touch-ups a little bit more if we need to, like on the forehead.
And I've been doing Botox now since I was 25. I'm 31 now, and so we started doing my treatment for more preventative, in really just kind of keeping me from getting my lines any worse. So
excellent. Yes, excellent point. The average age for Botox is
24.
Yeah, so she was right on. The rest, not all of us. A lot of the other ones are young too, but some of us not so. Lift up those eyebrows and relax. So that's a very important point, that a lot of people are doing these treatments now for prevention, and that makes it so much better because you don't need as much Botox. And I've been having actually quite a few more guys come in because it's becoming more mainstream. Sorry, was the yucky one. It's becoming more mainstream, and more people are talking about it. Thus, why the system crashed because so many people want it. I mean, you just can't go without it. You did great.
Thank you.
Of course, I've messed up her makeup, so
That's okay.
The beauty is that if we do mess it up, we can absolutely fix it, and you can go right back to work. Yeah, we did you a different one. I think
I'm bleeding today.
Just a little, but it should be fine in a second. Yeah, it's already stopped. We'll have you hold that for just a second.
Yep. Thank you.
Okay, so on to the next one. You going, Jill?
Sure.
Okay, so when you, well, I'm getting ready with you. See, and you bring the treats to me.
It's
Okay,
supposed to be me.
so you, I don't know what you want to talk about. Talk about something while I'm getting ready. Why do you love Botox, Jill?
I love Botox, especially for my forehead. I've got lots and lots of lines on my forehead, so it softens those lines. And same thing, I like to have some movement, so it's just good that it softens the look without making you look frozen.
And what is your role here in the clinic?
I'm one of the nurses. We have 2 nurses, Taylor and I, and we do Botox. We do laser treatments. We do old therapy, which is a non-surgical facelift. We have a new treatment, Secret RF, which is great. It combines kind of like microneedling and radio frequency. Cool sculpting, so we have a wide range of fun things that we get to offer.
Good. And Jill's been with me, almost 12 years, on and off. She's had a couple of kiddos in there, but she is instrumental in this clinic as well. And I turn to her a lot because she has so much knowledge, and appreciate having her on the team. Okay, so we're gonna do your labella first. I'm gonna lift this up so you're a little more comfy. Okay, so we're doing hers a little different today too. She feels like her
Left eye is lower.
right eye. This one? That you feel like that one's lower? Just okay, I have to reevaluate. I thought this one. That's what you told me. Hold on,
I think
time
you
out.
You're right. It's
Okay.
my right eye.
So
It must not be that bad if I can't even remove it.
it's one of my eyes. She feels like her right eye is a little more flat than her left. So what we're gonna do is do 2 injections on this side to hopefully give her just a little bit more lift, which will round out her brow a little bit more. Now, you maybe can see that, but it's very slight, like right through there, it's a little flatter. But we do see this a lot in patients that one eye is way lower and the other eye. So we are, constantly trying to figure out, okay, if we go here, here, and even out here, that should lift this a little bit more and hopefully even them out. Our Ultherapy treatment is excellent for raising eyebrows, and we even go as far as doing one eye and not even bothering with the other one to try to even them out. And I absolutely love Ultherapy for eye lifts. Let me switch sides here. And we usually recommend doing those every 6 months. All right, so we'll see how that gives her a little bit more of a lift. Now the other thing we did is we backed off her forehead a little bit because even though she says she doesn't love her lines, I mean who does, but she really doesn't have bad lines. So with her we'll probably just have to inject a little bit more often. Okay, so lift those eyebrows. All right, so relax. And then we're same thing, we're just going straight across her forehead. So the whole technique is similar for everybody. It really comes down to how do we lift, how do we, relax. Like let's say that this eye was way higher than that one. I would probably drop a unit like down here just to bring this one down a little. Obviously we want to try to lift here. So that's where the art comes in, is that it's not just coming in and going, okay, boom, 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 we're all done. It's about really evaluating the face and figuring out what we need to do to make her look a little bit more even. Again, she's not that uneven, so I don't think that that's an issue at all. We're doing 24 around your crow's feet? Okay. So 24 is what's the indicated amount. Smile big for me. She doesn't need 24, but she...
You can back off if you want to.
No, you have lines here, here, and here, so it's not like it's going to hurt for you to just last a little bit longer, which don't we all want? So, there we go. I was going to say something else and I forgot. Oh, I was going to talk about skincare a little bit. When we're sitting in the chair, a lot of times we'll talk about skincare and just talk about what we're doing. Smile big for me and relax. Because sunscreen is the #1 product that we need for anti-aging. But if we're trying to treat things, then we'll talk about all the different issues that patients have and what products are going to go going to be best to treat it. So let's talk about, while I'm switching, oh wait, we have Chin, sorry, Chin. Let's talk about what products, did I wipe the Chin? You're on, and let's talk about what you're trying to treat first of all, and then what products you're on.
So the biggest thing is to be on growth factor. That's kind of our workhorse product. And most patients are on the TNS Essential Serum, which combines your growth factor and then also your amino acids and peptides. So basically it's helping to build collagen, treat those fine lines and wrinkles, but also going to give you some brightening and treat sun damage as well. I personally am on recovery, which is the growth factor portion of that. Hormonal acne prone, so it just takes away that extra product that could just irritate acne a little bit. So I do the growth factor. I'm using the newest product, Lumivive, which is a morning and a night serum. It protects from blue light and has great antioxidants in it as well. It's the new age antioxidants. And then I have to think about what the order I put this in. And I'm also using Pep Up. Pep Up is a color science product, and it's also antioxidants and hyaluronic acid as well. And absolutely love that too.
Your skin looks amazing.
It's changed a lot.
Are you
in the last
doing,
month or two.
I'm going to do her chin. So we haven't talked about chin yet, but can you make an orange peel? Yeah. So see how it just kind of, we call it an orange peel. Hers isn't terrible, but it just relaxes this muscle and we're doing 10. And so it'll just relax these little baby lines that she has down here. But are you still using retinol in the evening?
I am. Love
Okay.
retinol, and also Aha Baha cleanser. So Aha Baha cleanser helps with it's the alpha beta hydroxy acid. It helps with exfoliation. And then I use retinol at night, and so retinol's breaking up the dead skin cells, and then Aha Baha works like a vacuum and sucks that off in the morning. So as we age, we tend to build more skin cells on our face. Kids are constantly turning over new skin cells, and that's why their skin looks so beautiful, and that's the skin we want, is the same skin we had when we were 5 years old. So that's why using the growth factors and then increasing that cell turnover rate really helps get us that young skin back. Another treatment in clinic that is a very simple treatment but it's awesome for that is our hydrofacial, because you're getting a mini chemical peel and a lot of antioxidants at the end of that treatment, so it gives a lot of brightening as well.
And then as far as your color science, you're using All Calm.
I
Right.
use All Calm and Pep Up are my two main ones that go on my whole face. And then I love the sunscreens, so the Total Protection Face, and then the Sun Forgettable Brush is a powdered sunscreen. It's a 50 SPF powdered sunscreen that is water resistant. Amazing, love that product. And then I use the mascara and also the lip gloss. So,
And the lip gloss
Yeah.
has, I think, SPF 35 in it. So we love that. So, okay. Anything else you want to add? No, you're jumping off the table.
yeah, as I mentioned all those products, I will say that I traveled last weekend and I had them all sitting out on the counter when I wasn't going to check my luggage. And when I had to pick what I was going to bring, that was really hard because I wanted to take all of it.
What did you choose?
I brought Recovery, Pep Up, and All Calm.
Perfect.
So,
yeah, so you had your
Growth factor,
factors.
antioxidants,
Yep.
my hydration, and my
and then your
sunscreen.
sunscreen.
Yeah.
Good choices, girl. Good choices. Okay, so Stephanie, who is always behind the camera, finally gets to come out and be on the camera. So let's talk about Botox, because this is only your second time, right? So what did you think about your first visit?
Loved it. It was super easy, super quick, didn't even feel it. I talked through the whole treatment, didn't realize it was done. I only got it right here, so I can't frown at everyone. My husband liked it.
Good, good.
I just liked how smooth and simple it was, but I could still raise my eyebrows. I could still go like this. That's the one thing I wanted to still be able to do, so I loved it.
Good. So she doesn't have much movement either, and they lift your eyebrows, and I can't remember, but when we injected here, did that take care of the lines on the forehead as well?
Yeah.
Yeah, I think, yeah, you don't have much at all. And then go ahead and smile for me. And she has nothing around her eyes. So she is very lucky because she really does not need very much at all. And so that goes to the point too, because everybody thinks that, you need a ton, but on one hand, everybody thinks you need a ton, and then on the other, everybody thinks you don't need very much. So there is a happy medium a lot of times, but as I mentioned, with most people, we're treating 3 areas and it's indicated for 64 units, and that sounds tremendous for people, and they're always like, oh my gosh, I can't do that. Well, I do over 70. So I still have movement. I have way too much movement going on today. But the point is you can still look very natural with 60 plus units. Now, we won't go to 100 units, but we can look natural. Botox is a scary thing because you don't want to look fake. So, okay, you ready?
Mm-hmm.
Okay. So, that's 5 units. Another 5 units. Very good. That's it.
So quick.
Easy, easy, easy. Okay, so we'll switch. We've got Taylor and okay. Oh, I'm next. Are you doing
No.
last? Okay. All right. So Taylor, Miss Taylor is next.
Hello.
So introduce
I'm
yourself
Taylor. I'm the other nurse here.
and
And we got some Botox. My forehead is moving way too much. See that?
so talk about because you've been doing Botox now for about 3 years, probably.
Yeah, around.
So I love to tell the story of your line going across and when you I don't know it was probably a year and a half into you doing Botox that you came to me and said, look at my forehead. So tell that story.
So when I first started here, my wrinkles were out of this world. I can't believe I got hired, to be honest. But yeah, it took like a year before I got Botox to smooth out those bad boys. But now I don't have any, so thank you.
You are so welcome. And you were how old when you started your Botox?
I was 24.
Okay. And so what she did is she actually brought me a picture of her lines and said, I can't believe you hired me. I'm hideous. This thing is not hideous at all.
You
So
could
I
not
love
be hideous.
No matter lines or no lines. But I love telling that story to my patients. It makes me laugh. So, okay, so same thing. Taylor doesn't need very much, which is awesome. But really, I mean, this line going across was pretty deep.
No one believes me.
No, I
It
know.
really was.
I know. We should put that on a post and show how deep that line really is. Oh, chin too. Thank you.
Just labella for your chin.
Oh, okay. No, pussy. Thank you. Okay. All right. Ready? I love your little hair. I don't know. Would you? Oh, a scarf? Is it a scarf?
It's actually on a scrunchie.
It is. I love it.
Thank you.
Okay. Well, let's talk about what if you had to pick one service. What would be your favorite service here?
Botox.
Okay. Second favorite.
Second favorite, to like as far as to do to people or to have done.
Let's do both.
So I love cool sculpting.
Okay.
I love doing limelight, just because I don't know. A lot of times the results are so drastic, a lot quicker than for limelight than other things. It just takes time to build the collagen on the other treatments. To have done,
Lift those eyebrows for me and relax.
probably love having hydrofacials. Those are great. Laser Genesis is amazing. So it helps tighten the pores. It helps with breakouts. Get a little anti-aging in there with the collagen stimulation. Those are probably my two favorite
favorites.
Yeah.
Okay. So let's go back to limelight because that was your favorite to do because you do see amazing changes. What is limelight?
So limelight is a it's not really a laser, but it's a laser treatment for hyperpigmentation. It can help with some redness too, but basically it targets the pigmentation on the skin and it pulls it to the surface and it gets darker for a couple of days and then slowly flakes off. So we see great results in evening out the skin tone and really lightening and brightening the pigmentation.
Good. So this is a perfect time of the year
It is.
to have that done. So that's definitely one of our favorite treatments to mainly, like you said, the brown spots, but also can help with red spots and just evens out the whole skin. We always recommend, as I said earlier, product with that. So which product would you say, especially for the brown spots?
Lytera,
Yeah.
for sure. Even Up
Good.
for your sunscreen and to help work on those spots.
So see, I'm testing them.
Did I pass?
You did. You did. You always pass. So okay, you're all done. So now it is my turn. Okay, so I will pop up here. I would have to say my favorite treatment is Botox as well, but my second favorite would probably be Ultherapy. Ultherapy is a treatment that I do annually, which helps to stimulate collagen to tighten up the skin. So I feel like that is something that will maintain my skin, and so as I age, it's not drooping as much. It's still drooping, but not as much. So Ultherapy, I'm actually almost due for that. I actually did it twice this year. The team talked me into doing it twice just to see if we got a little extra boost. And so I did a combination of Ultherapy and our new secret. Oh yes, thank you. She knows I'm a little bit of a baby, but she's really good, so I barely feel it. But anyway, so Ultherapy is something that I do absolutely every single year, and then the Botox, of course, every 3 months, and or touch-ups in between. I haven't had filler in 3 years, and that's why I feel like the collagen stimulation treatments have helped tremendously. I feel like I could use a little bit in my lips, just to so it looks like I have a lip plumper on, but overall, okay, ready? Overall, the collagen stimulation ones are best. And then, as you said, the hydrofacial, love that one. You get so much out of it. Yeah, I don't have a lot of movement, but you get so much out of the hydrofacial that I just love it. And you can see a change, you know, with your skin right after the treatment. See, she's so good. Oh, that one hurt a little. You spoke too soon. I know. No. Okay, so
I have a question for
Yes,
you. Do you think
yes.
are you gonna do filler? More filler?
I will. It's just taking the time to get it done. But one of the reasons why I haven't done it is because we were waiting to see what the Ultherapy and the secret
I
did.
didn't know it was
So
status.
yes, so I'm due for my 3rd secret treatment. So what do you want me to do?
Raise your brows?
Yeah,
I really don't have that.
I have a lot.
You have a
especially
lot,
up
but
here.
just not a whole lot.
Okay, so I didn't know if you wanted to do the
So Nicole drew up 15 and 14. Oh, so
14.
we're doing 12 to
2 and 2,
2.
or
No.
10, 2 and 2. Yeah.
10 to
Yes.
2.
Okay.
Okay. So let's
Yeah.
do that first. So
Okay.
wink.
Okay.
Why do you guys have them make those faces before you inject?
So that we can see the muscles moving and we know where to inject Botox.
So when I'm winking, she can see my muscle fibers.
Over here, and that's what we're trying to relax is these little muscles out here.
So we hadn't done this one on anybody yet in this video, and so this one is what we call lateral brow lift.
Come back around.
You're good.
So when people, I'm not necessarily, I mean, yes, I can always use a lift, but when people have funky lines here, we put that out here so that it relaxes those lines too. And we usually want to do like 2 or 3 units in there. And then, like, I didn't feel that one at all.
Raise.
And I would say my forehead is sort of medium, so I get lines that's more in my, like in my hairline. So sometimes I'm tweaking up there a little bit. Good question, Stephanie.
You're welcome.
Any other? What do you say?
I need more.
Okay. Any other questions? We talked about how long it lasts, so 3 to 4 months.
I'm gonna do 12.
12. Okay.
You come in and you see Dr. Jacobs first, but as you can see, our nurses do her treatment too, so you can come in and see the nurses.
Yes,
for injections.
absolutely. So both of my nurses have been trained one-on-one with me, and they've actually been trained 250 hours one-on-one time. So I don't take this lightly, you know, letting my nurses do the treatments. I absolutely am 100% confident that they can do it. I wouldn't let them inject me, or especially I wouldn't let them inject any of my patients. Some over there. Okay. So yes, once they see me after the first time, then we absolutely, Taylor or Jill can do it. So, hi. I'm the patient. I love it. Yeah. So, okay, so then we're doing, what are you doing? You're a little over here, and then we're doing crow's feet next?
Yes.
Okay.
Turn a little more towards me. Okay, relax.
or something. I don't know. Okay, so then we'll move to crow's feet, which normally I do 30 units, but I think we're only doing 16,
Yep.
so we're doing half the amount today because I really don't have much movement. So, I'll stop talking for a second.
And smile again. You normally like yours down lower here on this line.
Yeah, wherever the lines are. So if you're going to bruise, a lot of times the crow's feet is where we'll get a little bit of bruising. But hopefully we don't bruise at all. But if you do, we have a great corrector palette from Color Science that actually can cover tattoos. So we use it a lot after fillers too if anybody has any bruising. So
Jen.
Jen.
Yeah, come around this side.
Sorry, I'm all over the place. It's okay. That's moving around. Okay, there we go. Awesome. Okay.
Well done.
So I think we got everybody taken care of today, and as we said, it's National Botox Day. We love our Botox. So if you have any questions, you can always private message Steph. She will answer you. You can give us a call, come in for a consultation, and hopefully we'll see you soon. And you can join our Fountain Club because that's the best way to get discounts on your Botox. So give us a call at 618-288-9117.